Intake1, Project Unity's shared client poverty reduction software. What is Intake1? Intake1 is a software that helps multiple agencies work together to serve shared clients no matter what agency the client goes to first. What makes Intake1 special is that it is focused on clients and it's made for case management and it's designed for poverty reduction. In this way, Intake1 is the solution for tracking and reporting poverty reduction outcomes for shared clients of government agencies. Benefits of Intake1. Intake1 makes it possible to have instant updates on shared clients across programs. For example, this client was clearly served by 6 different people from 3 different programs. Intake1 also shows shared client outcomes over time. For example, this client in 2018 did not have health coverage and was having to live with relatives, but by 2020 was able to have health coverage and have her own place by participating in the Housing Choice Voucher program. Intake1 also easily reports shared client outcomes over time. For example, it will report outputs such as client requests and services provided, and outcomes through the National Performance Indicators, or NPIs. Other outputs that are indicated in Intake1 are which agencies referred clients to a program, which is referrer, as well as where clients were referred to. Let's take a closer look at the Intake1 system. The Intake1 system includes a comprehensive client assessment. This assessment includes information such as household info, income, benefits, education, childcare, transportation, medical information, nutrition, housing, criminal history, and family stability. In this way, the assessment provides a comprehensive understanding of the client's well-being. This information can also be printed out from the system and it appears in this form. Once you have that comprehensive information, it's important to put it to use. Intake1 has the first case note feature. This feature provides all the Intake1 assessment data and puts it into an easy-to-read summary, and also that summary is able then to be used by frontline staff to provide relevant services. The first case note establishes a baseline for the client and is also able to be used as a marker for client progress over time. And all of this is done with a simple press of a button. The first case note is automatically generated with a click of a button and is produced in this form. All that information is populated automatically into each section. Intake1 also allows service providers to make case notes. Case notes consist of information such as visit type, site, referrers, referred to, services provided, funding streams and amounts used to provide those services, client requests, and national performance indicators. Additionally, the outcome box is the place where staff are able to write their case note. In addition to the assessment, the first case note, and case notes in general, Intake1 has very useful reporting features. It's able to report service outputs and outcomes in real time. In this section, we will review the following types of reports: case note data summary reports, Intake1 assessment data summary reports, unduplicated client reports, log sheet reports, demographic reports, and at-a-glance reports. The case note data summary report produces case note data in a summarized form using tables. It summarizes data from case notes, particularly in terms of requests made, services provided, national performance indicator outcomes achieved, what agencies referred the client to the program, and as also where clients were referred out from the program in terms of referred to. The Intake1 assessment data summary report takes all the data from the Intake1 assessments and reports them in table form with counts. This provides a way to have a understanding of client conditions and well-being. The unduplicated client report provides an unduplicated list of clients that were served during a specific period of time for a specific program. In addition to the client names, select demographic information is also included. The log sheet report shows all the case notes for clients in a specific program that were made during a specific period of time. This report makes it easy for managers and staff to see how clients are progressing. The demographics report provides tables that show what kinds of responses were made in the Intake1 assessment for specific demographic information. The quick glance report provides the economic well-being of a client and includes information that is cash income as well as non-cash income in the form of benefits. And this report shows those benefits and provides a cash equivalent. In this way, the quick glance report makes it possible to have a more comprehensive understanding of a client's economic well-being. Intake1 captures the work done across agencies and programs. Here's an example. Starting in 2018, this client was unemployed. In 2019, the client decided not to attend Vista College due to the loan she would have to take out. Nevertheless, from the Brazos Valley Council of Governments, the client did receive financial fitness counseling from Jay Metters. She also attended a career planning work readiness class. Project Unity later on did Parenting Wisely classes with her, and here you can see where she started attending classes. She was able to complete Parenting Wisely, and Project Unity also was able to connect that client to its program, the Jobs Training and Employment, or JTEP program. This program provided the client the opportunity to become certified as a certified clinical medical assistant. And the client was able to attend a lunch with the CEO of HealthPoint. The client was able to successfully complete all of her coursework for the certified clinical medical assistant class. Remember that earlier she had decided not to attend Vista College because she didn't want loans, and this program made it possible for her to study loan-free. She obtained her training certificate and has been receiving assistance from and was receiving assistance from Project Unity to obtain a job. This client was served by multiple programs during these past few years, and Intake1 was able to capture all of the work that these different agencies have been doing to help her succeed. In summary, Intake1 is a simple database that makes it possible to collaborate like never before in serving shared clients.